Yeah.
Good evening, everyone, and a very warm welcome to our third webinar under our project core. So before we proceed with the session, I would like to take a few moments to briefly walk you through the project core. Project core is a community-focused oral health research for equity. It is a 4 years international research program aimed at addressing the long-standing negligence of our oral diseases in 4 middle-income countries. They are Colombia, Brazil, Kenya, and India. So this program was funded by UK's National Institute of Health and Research Center, NIHR, and so this is our team across the globe. We have a team working from UK, Colombia, Brazil, Kenya, and we have a team from India, Jamia Millia Islamia, PHFI from Delhi, and Ahmedabad Seva Center. So in India, the project has been launched in October 2024. The launch event was graced prominent public health professionals, deans, professors from various dental colleges across the country. As one of the key components of the project core, it is the training and capacity building of the early career researchers. We aim to build a long research sustainability by strengthening the capacity of local research teams and providing them with a high quality training opportunities. And so far, our journey has been enriching with 2 engaging webinars that was held in December and January 2025. Also, we have hosted a 3-day workshop on quantitative research that was featured with 10 engaging sessions and hands-on training for the participants at Jamia Millia Islamia, New Delhi. So another initiative under this project is the call for master's student citizenship in dental public health at University College, London. So under these initiatives, a full 1-year tuition fees and living expenses was provided, and it was about 45 lakhs Indian rupees. And so far, we are proud to say Dr. Priyanshu Sivastava from India has been selected for this prestigious opportunity. Next program is the mentorship program. So here the early career researchers are being paired with the global experts for the guidance, and the 2 candidates are being privileged to being mentored by Professor Richard Bird. Also for the next round, we have few shortlisted candidates. So if participants, if you are interested to know more about it, so you can get touch in by this email for this program initiative. The next is the Responsive Research Fund, same for the early career research for all the 4 countries. And in India, the advertisement was announced on the PHFI website and career page from 10 to 22nd April. And here we have received over 100 applications, and 10 projects were selected with them finding of £30,000. So yeah, to know more about our project, you can follow us in the LinkedIn program. Also, you can check about our website, or if there is any queries, you can mail to us under this email ID. And with that, we would move to today's highlights, our third webinar series. To formally begin the session, I would like to invite our principal investigator, Professor Abhishek Mehta, to take the platform and introduce our guest speaker for the evening. Over to you, sir.
Thank you, Varsha. It's my privilege. Good evening to all, and it's my privilege to welcome Dr. Upendra Bhojani, a senior fellow, professor grade from Institute of Public Health, Bangalore today. Sir is a fellow dentist and a public health researcher, and currently a DBT Wellcome Trust India Alliance Fellow. He holds a MPH degree from Deccan University and a PhD degree from Ghent University. And he has studied on chronic care in urban poor communities, and his main focus is also on chronic conditions, tobacco controls, health system, health equities, which are common problem in low and middle income countries. He teaches or takes guest lecture on health ethics, urban health, political economy, and of course, he is actively engaged in research, writing, and knowledge translation. Sir will be talking on the commercial determinants of oral health or health with examples on oral health from an Indian context. So over to you, sir.
Thank you very much, Dr. Abhishek. I hope I'm audible.
Yes, sir, you are audible.
And
Varsha,
I
you can
will
stop
try.
sharing the screen.
Yeah, and Dr. Bursa, just confirm in case if you're able to see the slides.
We are able to see the slides.
Okay, great. Thank you very much for this opportunity. And I think it's like you mentioned, I'm a fellow dentist, though it's been many years that I have not been practicing or teaching dentistry, but that's how I started my career. And so I have a special place for dentists. So I'm so glad that I'm getting this opportunity to speak to the dental fraternity, particularly those who are also interested in some sort of community or public dental health. So what I'll try to do today is maybe in another 35-40 minutes, maybe I'll keep an eye on the watch. I'll try to introduce this concept of commercial determinants of health, which is relatively new and emerging field within public health. And we'll try to see how. So I'll try to see this as a more of a lens to look at oral health. And if we use this lens, how do we see problems in oral health or causes of oral ill health a little differently? Does it provide us new ways of research inquiries around oral health? Does it provide us new ways of intervening in oral health? That's really the idea. So as you figured out that, while I am a dentist, I have not been practicing for a long time. And I think all of you, I'm sure, knows more about oral health than me now. But what I'll try to do is that I'll try to provide examples from oral health when we apply the lens of commercial determinants of health. Maybe it's best that you help me in doing this. So I'll also try to engage all of you in a few of my slides where we can try to collectively look at what are those commercial drivers of oral health, of the dental issues. So with that, let me start. So I guess I'll rush through the outlines. We don't have to, I already explain you. So let's start with this basic introduction to the concepts of commercial determinants of health. Some of you would have, of course, heard about social determinants of health. And it's become a very established sort of concept within public health. And of course, we can look at what are the social determinants of oral health. And I guess social determinants always included the role that businesses or trade play. It's just that in last 20 years or so, we started talking about businesses separately just to put more spotlight on them, because of a couple of reasons. One is because I think we are seeing NCD epidemic, the non-communicable disease epidemic, where we can see that some of the major risk factors or the drivers of NCD epidemic are not bacteria or viruses, but they are really the commodities like tobacco, like alcohol, like ultra-processed foods, like fossil fuels, which are actually sold in open market, right? And there are businesses which have to make profit out of this, and so there is a push to put a spotlight on these businesses. But also, I think the fact that businesses themselves have become very dominant players, not only in our society but also in health. I was just looking at, if you look at top 100 economies in the world, It seems that more than 50 of them are actually not countries. They are not sovereign countries, but they are businesses. And they increase even far more in number if you think about top 200 economies. So I think the kind of power that the private business entities wield is enormous, including within health sector, where we know that health sector is quite privatized. So I think these are some of the reasons why we see a renewed interest on looking at commercial entities. So let me quickly look at in what different ways commercial determinants of health are defined, and then we can see how through this lens we can look at commercial drivers of oral health. So there are several framings around commercial determinants of health with somewhat differing interpretations. Like I said, it's a relatively emerging field, and so there is no single definition which is correct or which is incorrect. But just to trace, I think the Miller wrote in 2013, which is quite some time ago, about a small commentary where he talked about good, bad, and truly ugly corporations. When he talked about truly ugly corporations, he really referred to the tobacco and alcohol companies, which he felt that are terrible, not only because they produce lethal products, but they also have terrible behavior in society. I think more recently, the whole CDOH discourse became prominent after the Ilona Kickbush and colleagues wrote this commentary, or rather a paper in the Lancet, where they also provided some sort of a framework of commercial determinants of health. There they say that the CDOH are strategies and approaches which are used by private sector to promote products and choices. This means consumer choices that are detrimental to health. So that means that are negative to health. So this is a very explicitly negative framing of commercial determinants of health. So some of us who are, let's say, working on tobacco, alcohol, mining, and those kind of sectors could relate to this, because our concern came because these sectors were having a lot of negative impact on health. But then in the same year, there was a different approach in defining commercial determinants of health. And they talked about any goods or services where there is an inherent tension between the commercial and public health objective. And I think, let me take an example to make it easier. So for example, let's talk about COVID-19 vaccine. Unlike tobacco or alcohol, COVID-19 vaccine, I guess, was widely seen as a public good product, right? It was a product which was very crucial in managing and ultimately ending the COVID-19 pandemic. So it was a good product. But what ended up happening, as we know, is that not everybody got COVID-19 vaccines when they needed it. So you had rich countries which were able to procure or produce COVID-19 vaccines. At times at a level where COVID-19 vaccine dosages were going west, as we saw in the newspaper. It happened in Europe, it happened in US, while there were some of the African countries which never got COVID-19 vaccine throughout the major phases of pandemic. And so you can see that the commercial interest of profiting out of producing COVID-19 vaccine and selling into the countries where there is a paying capacity, and the objective of public health, which is to provide COVID-19 vaccines to those most in need, were at the loggerhead, right? So then maybe it's a different way to look at commercial determinants of health, where the products need not to be necessarily bad for health, but it's the commercial interest behind selling that product which may not be aligned with the public health objective. And lastly, I'll mention the last and more recent formulation of by WHO. WHO now has a whole page on what they call commercial and economic determinants of health. They define commercial determinants of health as the private sector activities which affects people's health directly or indirectly, positively or negatively. So you see there is also a very different element here, which is a neutral framing of commercial determinants of health. So unlike, let's say, how Kickbush defined in the Lancet paper, here we are talking just like social determinants of health, that basically we are talking about commercial entities and the commercial operations and commercial interest, which has impact on human health, whether directly or indirectly, whether positively or negatively. And I think The Lancet later came out with a series of articles. I think it was three paper series on commercial determinants of health, which also defined it in somewhat neutral way, just like how WHO defined. So this is how broadly we understand commercial determinants of health today. You can still see some commonality. We are talking about private sector. We are talking about impact of private sector on health, whether positive or negative, or a tension between the commercial and public health objective. So now, what I thought was to also introduce some of the simple frameworks of commercial determinants of health. And I really don't want to bore you all with a lot of theories. So what I thought to do is to just introduce one very simple framework and then try to see, looking through that framework, how do we identify commercial drivers of oral health, let's say, especially in India. Like I said, I'm not an oral health expert really. You know probably much more than me, but the idea is to really introduce a new way of looking at oral health through this lens. So let me start with this very simple framework, which Melissa Malone published in 2020. What she did is she really did a literature review of those publications earlier which talked about commercial determinants or corporate determinants or industrial epidemics, and she tried to provide some sort of typology. And I think it's very basic but very interesting and important. So what she told essentially is that there are three levels at which commercial drivers of ill health operates, right? One is either you have products which are impacting our health, or not about products, but the businesses or the corporations that do some things which are harmful to people's health. Or there is a next level. She calls it global drivers, but you can think about these as more macro level factors, which are not about specific businesses. And these are the factors which also impact people's health. So the commercial drivers operating at three different but interconnected levels. So let me then I think there is enough of me talking. Let's go to a kind of a slide where you all can engage. So I hope you all are able to see this, and I'll try to create a QR code here. So if you are able to see the slide, I would really like you to take your smartphone and just scan this QR code. If you can scan this QR code, you would be able to go to a platform called AHA Slides. For some reason, if you are not able to scan the QR code, you can just type in this, which is ahaslides.com, and then you will have to enter this passcode. But I can see that some of you are able to already launch onto the platform. I can see 6 of you, 7 of you. So more and more participants are going. Once you are there, I would like you to just answer some of these questions. I won't be able to see, nobody will be able to see who is typing, so don't worry about it. And you don't have to type a lot of things. You can just type words, phrases. Let's look at, now we are talking about the basic level, which is the products, right? The consumption of certain products and services are harmful to oral health. And I'm limiting it to negative framing because it's easier, because we all are concerned about negative impact. So if you can start typing and posting, submitting. Okay, wonderful. So I see that sugar products and beverages, and of course there are also sugar sweetened beverages, but there are, beyond beverages, there are a lot of food products which has a lot of sugar. And I think that's very interesting industry we have to keep in mind. Dental caries has a direct correlation with the sugar consumption. Tobacco, of course. It's being a dentist that I made my career into tobacco control, because working at government dental college, I used to see so many young people coming with, the oral submucous fibrosis or some precancerous signs. And it was terrible to see that how smokeless tobacco particularly was affecting people in their 20s and 30s in those years. Junk food. So basically, we also may call them, let's say, ultra processed foods. So basically foods which are high in unhealthy fats, high in sugar, high in salt, and we are all surrounded by those foods. Vaping, very interesting. All forms of tobacco, of course. Chocolates, so again, sugary and sticky foods, which are particularly, cause sort of acidic environment, cause bacterial growth, leads to erosion of enamel. fast foods. Yeah, it's interesting. Somebody has mentioned about Colgate. Very interesting. So generally, people would see toothpaste as probably desirable hygienic product for oral health. But then we have also seen studies where you have toothpaste or dentifrices containing agents which are not desirable. For example, there have been published studies from India which says how many of the toothpaste and tooth powder brands contain tobacco or nicotine. Some of them contain excessive level of triclosan, which is again, we know that we have a long-term safety profile is questionable. Alcohol, very important, because I think more recently we know that any amount of alcohol is problematic and has been linked to oral cancers also. Wonderful. So I think I'm mindful that we also have less time today. So, but wonderful. I think so. So I think the thing is that how about much of the research today is limited really to tobacco and alcohol, maybe, right? So maybe we need to do more studies on implicating, let's say, food industry, or implicating some of the other industries which may not have appeared here. I think arecanut, another important thing. Last time I was at a Goa Dental College, and some of the folks were mentioning about binge watching of OTT. It seems it is affecting the kind of food habits where people binge watch and then also then binge eat the ultra processed foods. The night habits of brushing and things also get affected. So there are a lot of things that we can think of. For example, we can think of pacifiers, which is widely used, maybe not so much in Indian context, but in other countries, which are also then linked to a possible open bites, cross posterior bites, more oral infections. Also, I think nowadays I see a lot of advertisements of invisible aligners and things, and I don't know how many of you think about it, but I also keep hearing that, while in the advertisements you only see, the good aspects of it, I actually wonder how safe and how, these aligners are. Uh, but anyway, so let's move forward. I think wonderful. I like that many of you engaged. Just be there because there are more slides. I would like to go to the next one. And just before you start putting your answers, let me just briefly explain what I mean here. Remember that three level: product, businesses, and the broader factor. So now we are talking about businesses. We are not talking about specific product. So we are not talking about tobacco. We are talking about what tobacco companies do, which is harmful. Right? So not just tobacco company, but any of those businesses that you are mentioning, or maybe even more businesses. So I would like you to think about what activities the businesses do which you feel are harming the oral health in India. Wonderful. So there are companies which are targeting children, which is not desirable. For example, for tobacco particularly, we have a lot of documentation. There is something called Tiny Target Study, which is recently published in India, and you can see how tobacco companies are still, despite they are prohibited to market to children, how that happens. Glamorization with celebrity endorsements. Yes, I think I'm not a a Bollywood fan, but when I see, I think all kinds of actors I knew in Bollywood are selling pan masala and gutka, unfortunately, and so is also some of the sports celebrities. And that applies not only to tobacco. I think we have seen it in alcohol, we have seen it in ultra processed foods. So marketing, definitely, all kinds of marketing, particularly marketing of the products which are harmful for oral health, is a problem. Addiction, so addiction causing products, which can go beyond just the tobacco or alcohol. In fact, there is interesting science around how ultra processed foods become higher and higher in the salt content and the sugar content, because those are the things that make them addictive. Masking harmful products, maybe misleading people, promoting flavors. I think one of the major battles in tobacco regulation has actually moved towards the flavors. So wonderful. So I think, thank you so much for those who are joining. I think given just we have limited time, what I'll do is now I'll go further and I'll try to see how do we categorize these so that we make sure that we are not missing out. But I think I'm glad that many of you covered uh, many of the things that I wanted to bring. So let's say we can basically think about three major buckets of activities that businesses do, which can impact oral health. And I think the idea is also to see these as possible ways of research inquiries, right, in oral health. So one bunch of activities is the market oriented, meaning the activities that companies do, which are aimed at enhancing the market. And I think many of you mentioned about marketing and advertising. And I think there are a lot of issues there. Of course, we have seen a lot of surrogate marketing of tobacco through pan masala and gutka. We also see alcohol marketing, in a way, surrogate marketing. You have music series, you have mineral bottles, which are the same brand name as the alcohol brands, and they're being sold. But similarly, we have seen a lot of misleading advertisements of toothpaste, for example. In fact, I have not seen lot of outrage from scientific community, but I think if you look at, I was able to see some of the legal cases where some of the the toothpaste manufacturers were implicated either by the FDA of the state, some of the states, particularly Maharashtra FDA has been active, or by the courts, or by the Advertising and Standard Council of India, where you had some of the major brands misleading advertisements. So, for example, I came across the claims where, for example, one of the toothpaste brand used to say 130% germ check power, a germy check kind of toothpaste, clearly was a problem. Not just because it is a false claim, but many of these toothpaste in India are actually registered under the Drug and Cosmetic Act under a category called cosmetic. Very few toothpaste are actually registered under what is called therapeutic or drugs, and then there are some which are registered under the Ayurveda. So I think that's where they got into the problem. In fact, there was another brand which says the 100% guarantee in anti-cavity protection. I wonder any of you as experienced dentists can give such assurance to your patients while a single toothpaste was giving. Basically, these are selling gimmicks, of course. You had toothpaste which says if you use those toothpaste, then the users don't need to use floss or mouthwash. This was one of the Pepsodent brand, if I recollect well. So I think these all are ways in which marketing and advertising can be problematic, not just for tobacco or alcohol, but even for the oral health care products. In fact, there has been lately, we have seen aggressive marketing of cosmetic dentistry, be it about teeth whitening, particularly these invisible aligners, of veneer procedures, and the problem with these advertisements is also that I think they just glorify them without necessarily giving the right kind of information to potential users of these procedures. So these are some of the problems with that. And lately, I think the availability of social media has made it even more targeted. The advertisements can be very much targeted on social media, right? You can select the gender, you can select the age, you can select the location, you can select the educational level of the people who will see that advertisement on social media. So I think, and we are yet to regulate social media. Um, um, Pricing is the another way. And here, I think the pricing can work both the way. Any of these things can work both the way, right? Because I think you can also do campaigns on mass media, learning from commercial marketing principles called social marketing. And we have seen this in case of condom promotion, oral healthcare powder, oral, the powder promotions. So pricing also can work both the way. I think what the major example we have seen around pricing is that the idea is that you change the pricing, you play with the pricing of the product, and your market changes. So I think I remember in 60s and 70s, these experiments were started by tobacco companies. There used to be this pan parak, pan masala. Some of you may recollect those ads. Was it Sami Kapoor? Somebody who used to come and sell pan parak, pan masala in a large tin dabba, right? Not affordable by everybody. And then that is the industry which which experimented with what is now called sachetization. So they started selling pan parag in a small sachets, and suddenly the price changes drastically, and you have a huge market segment which never were able to afford those pan parag tins are now able to purchase. And so you can see how pricing can be used in many different ways. Pricing can be used. You can think about pricing of dental procedures. I think one of the dental procedures are probably one of the most prohibitive in terms of excess because of the affordability. And what can be done around it? I think the positive example could be the oral healthcare products. I think if when I go outside and stay in a hotel now, I have a very small toothpaste they give. Maybe you can buy it probably in 5 rupees or so. In some sense, making oral hygiene products affordable just by packaging them, and that's why being able to change the pricing. Similarly, one can think about acquisitions and mergers, and I'm not very familiar because we also don't have much data. This kind of research has not happened around dentistry and oral health, and I think that's why I wanted to introduce this angle. One can look at what kind of market concentration and market segmentation, what kind of competition exists within the oral healthcare products market or oral healthcare provision market. One thing we have certainly seen is that in last 10 years, you have seen the rise of corporate chains of dental care. And that's another way, and it keeps acquiring small private clinics, it acquiring others, becomes a bigger player, and that has a different influence on what kind of power they can operate in the market. So basically that's one bucket. Let me come to the second bucket. So now we are talking about activities done by the businesses which are not necessarily about enhancing the market. This is about activities that businesses anyway do and can impact people's health. So one is, of course, the supply and value chains. Let's say if we think about tobacco, one has to think about what are the supply chains of tobacco? Because generally we think about those who use tobacco and then they suffer from cancers and various other ill effects. But there is much more to it, right? Let's say if you think about BD, it's not just about BD smokers who are getting affected. The BD supply chain starts from the tendu leaf collection, tendu pata collection from some of the central Indian forest. And these are the people who are most marginalized, mostly many indigenous communities who go in the forest, collect it as one of the non-timber forest product. Lot of adversities. There are also tendu related forest fires which have been documented, and then they bring it, they sell it to village forest committee, it goes to middlemen, it comes to households where largely women and children roll BDs, again goes to middlemen. A lot of exploitation happen there of the workers. I think these are many things which we don't talk. We don't talk about the labor exploitation because the supply chains remains dark to us, right? And even when it is sold and it is used, what we have not talked enough is about the tobacco product waste. I think we just started talking about it in India. Huge tobacco product waste, which is toxic. In fact, if some of you have volunteered in any beach cleaning camps or even campus cleaning camps, cleaning activities, you will see that cigarette butts are one of the most common litter. And these are toxic litters. So I just gave you example of tobacco. The problem is we don't have enough studies around what are the value chains of dental products. One of my colleague here, Rajiv, was sharing with me that nearly 80 to 85% of the dental products used in India are imported. And I think Germany is probably one of the major exporter of dental products. And I think that tells you something. If your supply chain is lying like this, if you are heavy dependent on import, naturally procedures will become very costly for the dentistry. There is very limited local production of quality dental products. Similarly, one can think about legal compliance, meaning what is the behavior of many of these industries in terms of the land of the law, right? And we are just talking about tobacco marketing, how they are bypassing the legal restrictions in India. I think again, some of the dental friends were sharing with me how you have this apron wearing dentist who sell tobacco, who sell toothpaste, right? Now, even if the dental code in India may not allow it, and then the company will hire, the NRI dentists who are sitting not in India but elsewhere, and so they bypass the legal and ethical conduct of DCI, which otherwise prevents dentists to market oral health products. So these are the various ways we can do research inquiry into what is it that the industries, including the dental manufacturers, are doing in terms of various of these things. And a final bucket of activity, which we should be worried about, is the what we may call corporate political activities. And I think these are again activities which are not about enhancing market. They are not even about business operations. These are purely done to help company build power, a soft political power. One of the things is, of course, the corporate social responsibility, which has increased tremendously, partly because the government of India has mandated large businesses to do CSR. And one may say that CSR is not bad. I mean, it's good for businesses to contribute to society, and in principle, I agree. But I think it becomes difficult when either companies like, let's say, tobacco and alcohol do this, where they mask their lethal image behind a do-gooder kind of an image, or when businesses do this merely as a eyewash, what is called greenwashing, right? Where by doing something good, they are actually not changing their harming and harmful practices. Again, this is something we have to think about, because I have seen, for example, that in India, one can see how some of the major dental companies, I think Colgate is the one that comes to my mind, does a lot of CSR, but it also helps them, and they are very strategic in terms of what kind of CSR they do. For example, they have done a lot of CSR in collaboration with the dental associations. And I think that creates a very different dynamic. Often this has resulted in sort of favorable endorsement of the product by professional associations, or they have sponsored dental conferences in India. Or they also have funded school-based programs, let's say, for example, where they provide dental checkups, but also free toothpaste and things. But this all leads to, remember, this also leads to their entry into the potential market, promoting specific brands. Many of these school health, oral health initiatives have been very limited in terms of talking about brushing. And particularly talking about increasing brushing frequency, which actually benefits commercially to these companies, rather than talking holistically about what other things are also part of oral health and need to be dealt at school level or in the early life. Similarly, companies, of course, do lobbying, which means that they use influence, they try to influence the lawmakers. And in India, again, unfortunately, we don't have enough research in this area. So we have really lack of evidence. But I think lack of evidence doesn't mean there is no lobbying. There has been anecdotal evidence of how, for example, companies in India have tried to resist regulations, particularly about ingredient disclosure. There were issues about triclosan content, I remember, because triclosan is one of the antimicrobial agent, but is also endocrine disruptor, and we don't have long-term safety profile for it. But I think many brands, many companies pushed for retaining the triclosan in toothpaste, partly because they can also say we are antimicrobial toothpaste. There were also, I think, issues around using so-called natural or organic sort of content in toothpaste, and things like that. Funding is another big way in which I think toothpaste companies particularly, and maybe other companies, have played a role. They have not just funded conferences, but I think there have been, in India, there have been fellowships given to BDS students, which are mediated either through dental associations or independently by some of these companies. I think there are more examples. I'm not getting specific incidents, but when I was preparing for this, I did come across more examples. But I also feel that this also reflects on how we have not done certain kinds of research around oral health, and I hope that we can do it more using such kind of a lens. And let's get to the last part, really, which is the third level, which is about what are the factors which are operating beyond businesses. Oh God, I remember that I think this is the last part I wanted to cover. So if you want to give it a shot to see, now we are not talking about products. We are not talking about individual businesses. We are not talking about tobacco company or a toothpaste company. What do you think are the even bigger issues which are beyond specific businesses, which is something which can impact oral health, and we can research them as oral healthcare professionals? Maybe I'll just wait for a few seconds, given that I'm probably otherwise going to run out of the time. Yeah, I can see some of you are getting onto the system. Feel free to keep typing words. There's no judgment here. Accessibility, wonderful. So the access to care. Inequality, another very important thing. What are those larger factors which are actually contributing to the oral health inequality or oral health inequity? I'm sure it's not just about the companies, or it's just not about the products. There are larger factors which are implicated here. Political influence, wonderful. It's 6:50. Abhishek, I hope I will take 2 or 3 more minutes, maybe because we started late. I'm running out of that time, so that we can still have maybe around 5 minutes for any open interactions.
No problem.
Yeah. Awareness, general social norms, right? Everything is not just about the laws or about the commerce. Lobbying, yes, but maybe lobbying is something that businesses have been doing, and we covered there. So wonderful. So let me then, maybe just like we did it with the earlier slide, let me go to again some of the buckets we can look at, and that's why we can probably research. Of course, remember when we talk about structures, they also become little more abstract. But that does not mean that they are not important. In fact, in some ways, they are more fundamental, which then shapes how businesses work, and which then shapes what kinds of products and products marketing happens. So one, and this is by Kaylee Lee et al. I think everywhere I'm putting some references down on the slides, but I'm happy to also share the slides in case if others wants to pursue further. So one is the broad political and economic system. We cannot just implicate businesses unless we look at the broader scenario. And I think the current system of production that most of the countries are under is what we may call capitalist system. I know as a dentist, we are hardly being talked about the economic and product and political systems, but I think in more simple languages, we are all living under a more capitalist system. And what are the key features of the capitalist mode of economic production? And I think in India, we adopted this, especially post 1990s, what we call neoliberalization, right? Opening up markets, deregulating, what was license Raj, etc., particularly Narsingh Rao government and afterwards. So the key feature of the capitalist mode of production is that the profit and the wealth maximization is the key goal. The idea is that if you create more and more wealth, somehow it will trickle down in society. Even if it gets accumulated by some people, it will ultimately trickle down. And that is the way to enhance economic well-being of everybody in society. That's the system. And maximization of wealth is the goal, and that's why you treat environment, natural resources, labor as really more of a disposable sort of factors, right? And that's something that has been happening. I remember when I was seeing Bollywood films while growing up, nearly one in two or one in three films will have this theme of a factory worker who will fight the union leader and the owner of the factory. And we no longer see those kind of themes in movies, maybe because that kind of unionization of worker has gone. In fact, you can see that influence now touching dentistry also, where you have corporate chains of dental clinics. And I think more and more those who work in those setups have been sharing that your professional autonomy as a dentist is reducing drastically, right? Earlier, in an individual practice, it is possible to either waive my fee or to reduce the fee if I see the need, or for me to decide what kind of medications might be needed. But in a corporate setup now, it's the manager who decides. If you are not performing enough surgeries, if you are not seeing enough patients, that's all are the indicators. And then you can't really have power to waive off your fees or some things like that. You have a computer which will suggest you brands, which will suggest you diagnostics, and more or less you have to stick to that. So dentists, who are the professional who had probably most autonomy, are becoming more like a factory chain worker. Now I'm simplifying it, of course, and I'm probably making it extreme, but just to make a point that this is what is happening. Basically, commercialization is becoming the key driver of oral healthcare delivery. I think there is interesting work that I came across by Malu Mohan, if I'm not forgetting or mispronouncing her name. But I think she has looked at in detail in terms of how commercialization of dental education and its relationship with how policy making has happened in the sector in terms of policy environment, what kind of struggle it has created for early graduates, the dental graduates, who are finding it very difficult to even earn enough or have very limited options to submit themselves to certain kind of economic system, right? So that's one. The other one is, of course, the governance. What kind of legal framework? And for tobacco control, we have a very good legal framework, and still we have gaps. But I think one can look at what is the legal framework. Is there an oral health policy in India? How well it is enforced? I know there is a movement towards it in India. How comprehensive it is, right? Um, why don't we have policy initiatives that reduces the dependence on imported materials? Will it make a difference? Why don't we regulate the labeling of toothpaste? Many things can be thought of, and there is a rich area of research about conflict of interest. We talked about how often there is a collusion between, let's say, even healthcare provider bodies and the commercial manufacturers, right, of dental care products. We don't have laws regulating lobbying really in India. We don't. That's why partly we don't even know what kind of lobbying these large oral care companies are doing in India. Some of you talked about inequity, and I think that's another important lens. Unfortunately, I don't have time to go into it, but I think we are one of the very iniquitous society, right? And when you are in that kind of a society, not everybody experience the similar impact of commercial drivers. It varies widely, and again, that's something to look at. How some of these commercial practices are driving oral health inequities further. And finally, of course, the social norm. It's not all about the laws. What is the role seen of business in society? What kind of I mean, I left dentistry nearly 20 years ago, and I don't live in the same small town where I used to grow up. But I'm told by the neighbors that they are still receiving annually one pack of Colgate toothpaste and the brushes, to me, because maybe I'm on that role of their list. And this is seen very normal. It's not seen as a corruption practice at all. So there are various factors one can look which are not about specific business, but still is about larger commercial and economic structure in society. So with that, let me come back to the same thing that we discussed, and I won't further complicate it. Maybe we will need one more seminar or a workshop, in case if there is enough interest, to talk about how to address commercial determinants of health. So I'm not going to go into these slides of how to address commercial determinants of health. And in summary, I think I hope through this presentation I at least try to make an effort to tell you what is the evolving understanding of commercial determinants of health. How can we apply it to the oral health, and how we can look at products, business, and structural level. What are the drivers of oral ill health? But we didn't look at the approaches to address commercial determinants. Maybe some other day, and let me call it an end. And I'm happy to engage in any discussion, any query or questions. I may not have all the answers, by the way, but I'm happy to do that. Let me unshare so that, yeah, over to you, Dr. Abhishek.
Yeah. Thank you, Dr. Upendra. It was a very engaging session, I must say. The way you have made it interactive with all those AHA questions and all, that was very nice. Yeah, that's my take, that the commercial determinants, the concept is very new to oral health. We still are at a very low level, I would say, if I use that word, as far as the research in dentistry is concerned. We are learning new things in that, and And today, I also learned one thing, that commercialization is beyond just the products. It is the way they regulate, the way they pressurize for revenue generation. That is also commercialization, whether you call it exploitation, but it's a part of commercialization theory. And yeah, of course, when you were, the way you have given the dental example is, it was very comprehensive. I don't have anything to add. I just remember one uh, advertisement which was one by one prominent company, and they've given the advertisement that in India there is fluorosis. There is fluorosis, fluoride belts are there. There is very high fluorosis. So there is no need of fluoride toothpaste, which is factually incorrect. It's scientifically it's incorrect. The fluoride, using the fluoride toothpaste in a dental fluorosis patient is not contraindicated. They're totally different actions. That is topical action. That is a systemic thing. So that's one, and it's misleading. It came in the front page of a very prominent English newspaper. So you can see the amount of clout they have,
Right.
when it comes to.
No, it's interesting to hear that.
Yeah,
Yeah.
yeah, it has come. I'll share the screenshot with you. I kept that one. Yeah, the CSR activities, we were also working on few commercial determinant thing. And the question comes that CSR activity are actually legalized by the government. So whether, how to look from that lens, but yeah, we have to go more deeper into what is the main idea or what to say, what is their intention behind doing those CSR activities, because they can be good activities, they can be some hidden activities also why they are doing it. I'll just see the question if somebody is having a question. Dr. Shaurya, you want to ask a question? Are you on? Varsha, do you need to unmute or something? Or you can put in the chat if you want, Dr. Shaurya. Just type your question.
Yeah, like you said, I think meanwhile the question might come, but
Yeah.
I think a lot of some of these issues have also been exposed more by competitors, commercial competitors, rather than scientists who have done research and built evidence in terms of, let's say, misleading advertisements and things like that. Many times it's the two rival companies who have not liked how other companies doing, and that's why they have taken each other to the court. And that tells that only tip of the iceberg comes out, because then I think that there are many things which they both are sharing, which are misleading, and then it's very difficult to capture unless we sort of investigate them. Same is with the CSR. I agree with you. I mean, CSR is a legal sort of legally mandated practice. What we ought to do is to look at what kind of CSR these companies are doing, not necessarily in a negative light, right? And see whether they are serving, are they in alignment with what National Oral Health Program wants to do, or are they more aligned in terms of their own commercial goal of reaching out to the markets they otherwise find it difficult to reach and stuff like that.
Yeah, that's the thing. The way they sponsor seminars, conferences, or get stamp from various associations, so that just to increase the publicity of their products.
Of specific products, yeah.
And
influence the prescription practices and things like that. In fact, I have seen some of the nicotine replacement brands, which are also commonly used by dentists to help people quit tobacco, supporting National Tobacco Control Program. And then I have also heard from NTCP for nodal officers saying that how they were a little frustrated that during those CSR projects, how they were not allowed to do kind of things that they wanted to do in NTCP, but rather they were often repeatedly asked about the data of the people whom program was reaching, or only focus on the cessation, because I think that was in the commercial interest of the company.
So
okay, I think
Gloria has. You can see the question, sir.
Yeah, I think she says dentistry has been more of a clinical curative service, whereas prevention too is important. So can sir share an experience of these diversity in relation to commercial oral health? Yeah, I think I think it's very interesting, and I don't know. I mean, we can talk about different aspects of these prevention and curation in context of commercial determinants of health. Let's say if I have to purely look from the commercial aspect, if I'm a commercial player, I have to see typically what happens is that the curative activities are commercially viable and commercially profitable, right? And preventive activities are often not, because then what typically happens is that by doing more of a preventive activity, you are actually killing your business, because then hopefully those people will experience less prevalence of dental caries and other issues. But I think that's a general sort of an understanding. But I think when you look at what is happening in medical sector, for example, we have also seen increasing commercialization of the preventive care. I was hearing to one of the very major tertiary care hospital director who was talking about how in the future they are envisaging a hospital where there will hardly be doctors, uh, because they are already giving away a lot of what you call wearable monitors, and I think this is becoming very very common. And then they are already sort of, so they are creating a market for the preventive care.
Yes.
You will see that many of those who are able to afford today have started either have a smartwatch or some wearable device where not only they but even their healthcare providers in real time are able to see when is it that the BP is fluctuating, when is that the pulse rate is going high, yeah, and various things like this. And it has in fact created an industry of its own where a lot of unnecessary preventive procedures are also happening. So I guess while I'm trying to think only negatively, but I think commercial determinants of health provides an interesting framework, either to do current study or to even do a prospective study and to say how to make how does the commercial driver can align with promotion of, let's say, preventive dental care, right? And it might be interesting work to do. I mean, this is a bit more hypothetical to me now, but one can look at it, and it can have quite a policy implications about how to engage private sector. Because I think if I understand, um, generally private dental or private oral healthcare sector has been largely cut off from what happens in terms of national oral health programs, which is largely focusing on the government's setup. And I think that's something interesting. So I think we can use a CDOH lens to see in what ways preventive care can be either commercialized, or how or what commercialization can do to the preventive care.
Any other questions?
Sir, I have one question. Yes, sir.
Please go ahead.
Sir, like the yes, sir. So like the oral health, like oral companies, like toothpaste companies and all, they do the CSR activities, and we can map them easily what they are doing for the oral health, like school program and all, advertising their toothpaste and all, release and all. So what about the this one, those beverages, ultra processed beverages and ultra processed foods? What about their marketing their sugary products in a marketing ways, like this is a healthy way, and how can we map all those their CSR activities that are affecting our oral health, and how can we uh, websites, or how can we map them?
So there are many very very interesting thing, and I think we must go beyond just oral healthcare products. I feel uh, I have two very young daughters, and I they just like the kids toothpaste, and I'm amazed at how this kids toothpaste have all kinds of flavor and particularly lot of sugar in the
Yes.
content, just to make them hooked to it.
Very
Something which
costly.
is very costly, and
Very
something that
costly.
could have been perfectly avoided, because I think the evidence would be other way around. You should not give sugary toothpaste. But anyway, coming to the whole sugar industry, or like that many other industries, let's say it is fossil fuel, it is sugar, it is tobacco. I think one is that in India, for example, now specifically speaking of India, because India has mandated corporate social responsibility, these companies have to make they are mandated to make non-financial disclosures uh, to SEBI, which is a Security and Exchange Board of India, which is a finance regulator. And these are called Business Responsibility and Sustainability Reports, BRSR. These are mandated annual reports which are submitted to them. And in fact, one of the SEBI affiliated institute called Indian Institute of Corporate Affairs has created a nice interactive dashboard where you can look at these reports. And these reports include CSR for sure, but it also includes what other things that companies are disclosing in terms of their impact on environment, their impact on their employee, etc. Now, of course, it is questionable how much to rely on self-disclosures by company, but at least it provides an important source of data for our research. I mean, this is something one can do sitting on the desk of what kind of CSR activities that sugary beverage companies are doing in India, right? And things like that. You can look at various aspects of it, and I think that's something which is important. Unless we have that kind of research and evidence and mobilization of oral healthcare professionals, we also don't become part of advocacy and activism in bringing necessary policies. For example, currently we really lack effective food labeling policy in India, and there's a lot of processes going on at national level to actually get food labels, but we don't see a prominent voice of dentists asking for strong front of package food labels, like we had seen dentists asking for gutkha ban, or like we had seen dentists asking for tobacco control policies, right? So I think it's partly many of us who just have to start dwelling into such research, or asking our PGs and research associates to start looking at this question. There are many, the range of data sets we have never explored, which are available in public domain, which can help us understand how marketing is happening. In fact, most of these companies are happy to put bulky reports on CSR because that's how they want to market themselves. And you just have to download that and see the narrative in terms of what they are doing. And then you can apply analytical lens of why certain companies choose to do only certain kinds of CSR activity, which are the kind of actors with whom they are collaborating. Does it make more commercial sense? Does it make more public health sense? And things like that.
Yeah. Which I think sir has answered your question.
Yes, sir. Thank you, sir.
There's one last comment from Liliana. She's from Colombia. So she's writing that in Colombia, we are trying to propose the category of corporate capture instead of commercial determinant to show that the problem is bigger than we think. So what are your views on that?
No. I think I agree. To the extent I understood this comment, it's true. Because there is also, I see that, the whole discourse of commercial determinants of health has also somehow became prominent and has been shaped by those who are working in NCDs, and has remained largely still about specific products or specific sort of sectors and industries, and somehow has not adopted enough political approach to look at. We are really looking at a more larger and more problematic corporate capture of
Yes.
policy making processes of um, so it's possible, and I agree that unless we talk about that language, it may be that we will still end up just looking at products. We may still end up doing some small studies around, let's say, advertising practices of certain company, while missing out. And I think there are some interesting work there saying that how we need to infuse more politics in the way we look at commercial determinants of health. So I think maybe that's how I take that comment, but I'm happy if Liliana wants to come and also sort of clarify it.
Yeah, that's it.
Okay, wonderful then.
Okay then. Yeah. Okay, sir. Thank you so much. Thank you for your patiently. You have answered each and every question. And
no worries. I
definitely
enjoy
will
this.
engage again.
Sure. So thank you rather for giving me this opportunity. Like I said, it's wonderful to get connected to a large group of dental and oral healthcare professionals, and it's really nice to see an international kind of collaboration and network doing such kind of work. And I'll be happy to be part again sometime later in the future. Thank you.
Yeah, so thank you. Thank you very much.
Thank you.
Thank you so much, sir.
You can stop recording.
Yes, sir.
I think he is left. Kid.